Well, welcome to another NJ Axe Team Science virtual seminar series sponsored by the NJ Axe Team Science Core. My name is Dan Horton. I'm one of the core leaders along with Nancy Reichman and Ralph Gelati. So if you've attended any of the other Team Science seminars, you know that our series features biomedical research teams and leaders from across the NJ Axe Consortium and teams conducting high impact multidisciplinary or transdisciplinary research, including studies that are funded by large federal or foundation grants. As always, we ask our guests to provide a high level overview about their teams and their projects, and then to speak about different aspects of their research with a focus on teamwork, collaboration, so we can learn from their successes as well as the challenges that they've addressed. I'll turn it over to Ralph to introduce today's guests.
Excellent. So we're really thrilled to have a great team with us today. I will introduce the first speaker, and Manny will have an opportunity to introduce his colleagues here today. We have Manny Jimenez. Dr. Jimenez is an assistant professor of pediatrics and family medicine and community health, director of developmental and behavioral pediatrics education at the Boggs Center on Developmental Disabilities at Rutgers Robert Wood Johnson Medical School, and an attending developmental and behavioral pediatrician at Children's Specialized Hospital. Thank you all so much for joining us today to talk about your team science project. We're thrilled to have you.
Thank you, Ralph, Dan, and Nancy. And so I'll go ahead and share my screen. All right, so again, pleased to be here with my colleagues to present work that we've been collaborating on now for a number of years. And so the current project is funded by AHRQ, the Agency for Healthcare Research and Quality. And we'll be presenting on this project, Ready and Healthy for Kindergarten, a primary care innovation to promote a 360-degree view of child health. This project is, I think, really representative of an interdisciplinary team, and we'll focus on the intervention development process, which I think brought our different disciplines, which represent pediatrics, education, linguistics, together to form a project to really support children in the community and their families. And so I'm here today with my colleagues in alphabetical order. Daniel Lima, our research coordinator, and who's really kind of been spearheading the community engagement aspect of the project. Dr. Lesley Morrow from the Graduate School of Education, who's an internationally known expert on literacy development. Dr. Silvia Perez Cortes, who's a linguist and who specializes in bilingual development and second language acquisition. And then Dr. Usha Ramachandran, who among her many hats is a community pediatrician and leads the state chapter of Reach Out and Read, which is a primary care literacy promotion program, which really served as a motivation for the work that we're doing. And of course, there's so many more individuals who've contributed to this project beyond the group that you see on the screen today, which includes really terrific scientists who we collaborate with, who represent fields like anthropology, sociology, biostatistics, and then also members of the community, so community leaders who've been serving on our community advisory board. We have also an active parent advisory board, which is made up of parents who participated in past iterations of this program and have really provided critical input into its development and implementation. The teachers who run the program, which we'll talk a little bit more later, other members of our research team, and then it really, again, representing sort of how this has been an initiative over the last few years, people who've contributed in the past, whose contributions have been just so critical to what we're doing today. And so I'll start off actually with sort of a case vignette that sort of is an amalgamation of different patients that I saw in clinical practice that really served as a motivation for this work. And so, really sort of clinical sort of experience driving kind of a research question. And so Nelson's an 8-year-old boy who comes in for an ADHD evaluation. His parents first became concerned with his learning and behavior last year when his teacher suggested he may need to be held back in 2nd grade. Now in 3rd grade, his academic performance has further declined. Nelson struggles with reading. When asked to read out loud in class, his pace is slow. He makes several errors. He's unable to answer questions about the text he just read. Lately, when he's called on in class, he tries to make the other students laugh. When pressed, he refuses to participate. He's distracted during in-class assignments, initiates conversations with his classmates during instruction. He lives with his mother and father, who emigrated to the US from Honduras before Nelson was born. Nelson's family speaks mostly Spanish at home, although he was exposed to English largely through media since his first years of life. Nelson began shifting towards predominantly speaking English when he began preschool at age 4. And so, despite the current academic concerns, Nelson hasn't received additional academic support, nor has a child study team evaluation been initiated at the school. Privately, a teacher's aide approached Nelson's mother and suggested that he appears to be showing signs of ADHD, and in her experience, medication can really help children like him. And so again, this is kind of representative of many cases I was seeing as a developmental pediatrician practicing here in New Brunswick, where the question was, does this child meet diagnostic criteria for ADHD? Are they a candidate for medication treatment? Yet there was so much more to the picture beyond ADHD as a diagnosis or medication treatment as one of the only options. And clearly, from seeing so many cases, it really was indicative of something more systemic that was going on. And so when we look at data in New Brunswick, currently nearly 8 out of 10 3rd graders don't meet grade level reading standards. And so there was a reason why these cases were coming so frequent. This was driven by looking for programs in the community that might be able to support children's academic development, and really not finding many programs that would serve children from Latino dual language backgrounds and their families. This was compounded by other concerns that we were seeing. Children who were losing their home language shortly after transitioning into school. And so, it really motivated sort of looking for opportunities to be able to work collaboratively with the experts that we had at Rutgers to design a program that might be able to better meet children's needs and their families' needs. And we were fortunate to be able to come together. Initially, really just a few pediatricians, myself, Usha Ramachandran, one of our other colleagues, Shilpa Pai, sort of, frankly complaining about the lack of availability of programs to be able to support kids, and then working towards developing something that could take its place or that could fill that role. And so, as I mentioned, there's a long precedence for pediatricians and clinicians in pediatric settings supporting language development and literacy development, and really Reach On Read is the exemplar in that way. So it's a primary care literacy promotion program that started in Boston and has now spread across the country in over 6,000 clinics, where pediatricians and clinicians in pediatric settings give out books, encourage families to read together, and provide modeling and literacy-rich environments. And there's a lot of evidence to support the effectiveness of Reach Out and Read and encouraging shared reading between parents and children, and supporting children's language development. Yet there's so much more that needs to be done. And so, which is reflective of the magnitude of the inequities that many children face. And so even when they receive Reach Out and Read, children remain at risk for reading difficulties later on and language delays. And so in some of our qualitative work, beginning to partner with Dr. Morrow at the Graduate School of Education and others around thinking, how do we augment the Reach Out and Read program to better meet families' needs? We did qualitative work to understand what were the barriers. And so this was one of the common ones. So parents felt their literacy skills and limited English proficiency prevented them from engaging in more shared reading together. And so this is a quote from one of the families who participated in this study. Well, I read with him the little bit that I know because I don't know how to read well. And so it really pointed to the need to support families in a more robust way. And so thinking across disciplines, and so from a healthcare perspective, again, the importance of developmental promotion in primary care settings, supporting optimal developmental health, including language and social emotional skills, which is really embedded in Bright Futures Anticipatory Guidance, which is sort of the guidelines for preventive care in pediatric settings. And then from educators' perspective, ensuring that children arrive at school ready to learn when they enter kindergarten. And so thinking through sort of best practices that can support school readiness, shared reading being a really terrific one that encourages both vocabulary development, technical skill reading development. And then taking into account family priorities as well. So working with the community in New Brunswick, which is largely from Latino backgrounds, wanting to really honor and embrace families' heritage and ensuring that there's so much more to language than words. Culture is embedded in language. Children's identity is passed on from generation to generation in this way. And so, thinking of ways that we can really promote families and really take a strengths-based approach. And so this was sort of the genesis for Ready and Healthy for Kindergarten. And so this mission statement is one that we arrived at with our parent advisory group, which I mentioned a little bit earlier, and Daniel will speak more to in a few slides. So Ready and Healthy for Kindergarten embraces linguistic and cultural diversity as strengths that form a foundation for child and family health and well-being. The program builds on primary care professionals' near universal access to children, educators' expertise, and parents' interests and dedication to support our shared goal of school readiness for children. And then, so just a brief program history before I get into more of the mechanics. So again, these conversations began from right around the time I arrived at Rutgers in 2014. By 2019, we had kind of formed the core nucleus of folks across the different schools that were interested in trying to put together a program for kids entering kindergarten in New Brunswick. And we piloted our first iteration of Ready and Healthy for Kindergarten at Eric B. Chandler Health Center. At the time, before COVID, it was an in-person program, which was the way you did things. And recognizing there's many things about pediatricians and primary care settings that make it a ideal opportunity to support development. One being the near universal access to kids. Nearly every child has seen a pediatric clinician in the past year. And then the opportunity to really build and leverage trusted relationships. And so the idea of sort of implementing this program, both like where pediatricians could refer families to the program and then being able to do it in the clinical setting. And so we had the first successful pilot that summer, and then COVID happened. And so we scrambled. We had planned to do another iteration in 2020 in person. And then we shifted completely to an online program or an online format. And then with the support of the Rutgers Global Health Institute seed grant program, as well as the Rutgers Community Health Foundation. And so we were able to pull off an online version and in fact found some real strengths to it in terms of the availability of families. It was much easier for them to join remotely instead of having to come down to the clinic. We then did another implementation pilot in the summer of 2021, and in the fall of 2021, we were awarded a grant and a R18 mechanism from the Agency for Healthcare Research and Quality, which I mentioned earlier, to conduct a large-scale evaluation of the program. So I'll do a quick overview of what the program is, and then I'll hand off to my colleagues to kind of run through the different sort of disciplinary lens that the program is informed by. And so it uses, the idea is to use interdisciplinary guidance and health topics to introduce foundational literacy and language skills, like letters and vocabulary. Really, the goal is to take this strengths-based approach and to be able to leverage things that families already do in their daily routines around topics like nutrition, physical activity, sleep. Routines like looking at a nutrition label at the grocery store, or counting when you're exercising, and pointing all these things out to families as ways that they can both live healthy lifestyles, but then also encourage their children's language development. And critically also ensuring that we encourage families to use and to promote their home language at home to encourage development across both languages. Briefly, each of the 4 themes, we've selected children's books which represent those themes, so nutrition, physical activity, sleep, social emotional development. And they really serve as kind of the backbone of the 8 workshops that occur during the summer. And so each week, a new children's book is introduced that covers the theme, introducing or providing an opportunity for discussion among the families and the teacher that's leading the program. And then taken from those books are also letters, vocabulary words that are then presented to the children during the session. And then we do created a at-home activity kit to be able to reinforce the activities that occur during the session when children go home. Also supported by text messages that get sent as reminders and motivators. The general session structure is a welcome from the teacher, running through the alphabet song, introducing the theme-related vocabulary words, then kids sing a theme-related song. They review the letters and letter sounds. They use exercise. They have exercise breaks and song breaks in between. And then families do a discussion around the health content and set goals. And there is sort of like a meta thing happening here as well in terms of the program structure. One of the things that for kindergartners, as any of us who've tried to get a kindergartner to sit to do any sort of academic work, breaks are really important. And so, the teacher is able to kind of guide families in terms of, like when school starts this academic year, it's going to be important to take breaks when you're doing this kind of work with kids, and to have the right kind of breaks. So not screen time, but something like exercise or a healthy snack. And so there's coaching that's happening during the sessions as well. This slide is busy, but it presents a logic model of sort of how we came about our evaluation plan for the for this project. And so, The program itself was really based on both theory and empirical evidence in terms of best practices for supporting both literacy routines and health routines. We worked to really ensure that parent input was a big part of the program development, to both embrace sort of their strengths as well as set priorities. And again, incorporating the input from across the disciplines. That led to the activities that are conducted in the sessions, and now we're in the process of the larger evaluations as I described. And so aim one was to really further refine the program, which we've completed 2 summers ago, and now we're in the middle of a randomized control trial testing the intervention compared to a control arm, while also conducting a process evaluation to understand how the program is implemented and lessons learned that will be important to in a dissemination phase in terms of hopefully bringing the program to scale beyond New Jersey. And so with that, I'm going to now kind of turn over to my colleagues. And so I'll start with Daniel, who's going to talk a little bit about our community engagement strategy and how we've partnered with parents as well as community stakeholders.
Yeah. Good afternoon, everyone. So the Parent Advisory Committee were really central to a lot of the activity or materials that we had. So they provided, as it says there, so the mission statement helped formulate that, the presentation of the logo, and also the logistics in terms of scheduling. So these are families that were previous participants in different iterations of the program. And so from their perspective, having been through one iteration of the program and also being a parent in the community, they really helped bring that perspective to help us in formulating and allowing restructuring of the program. And they were also really helpful in raising awareness of the research study to their networks and to the community. A lot of times they passed the word along, just given their experience that they had. So yeah, you can go to the next slide. And then the Community Advisory Committee. So these were local educators and community leaders. So for example, the librarian, children's librarian, people from the public school, and from the school district, and then also different leaders that have worked with the community for some time, and with different families and parents. So they provided, again, guidance on program logistics and planning, community networking, and also the awareness within their networks to provide more families, interest in the study. Once we get to the point of disseminating the results, they will also be central in that once we have results for this longer term study. And that's it for this piece.
All right, and now Lesley, you're up next.
Hi, everybody. First, I want to say thank you for including me in this important work. The collaboration has been a wonderful learning experience and a great deal of fun. My experience with Reach Out and Read goes way back to the 90s with Dr. Alan Mendelson at NYU, who called upon me for some help, and I've just loved it ever since. So as an educator, emergent literacy is the period from birth until about the end of first grade when children begin to read conventionally. Emergent literacy theory suggests that we engage children in early literacy activities that include listening, speaking, reading, writing, thinking, and viewing. These are all a part of the learning to read in the Ready and Healthy Kindergarten program. It uses, as Manny said, meaningful themes to build knowledge and engage children in early literacy, evidence-based strategies used in early reading instruction. Rarely is there an interdisciplinary approach to early literacy. However, Ready and Healthy for Kindergarten was created with the synergy between pediatricians about health issues, educators with literacy backgrounds, and linguists to provide for the bilingual part of the program. Ready and Healthy for Kindergarten is also a partnership with parents, teachers, and the communities, as Daniel mentioned. And the most important time to join these partnerships is in early childhood, and especially with children with vulnerable populations. The program is based on 4 health themes. Many mentioned that: exercise, nutrition, social and emotional well-being, and bedtime routines. Children listen to a story, discuss them to build vocabulary, and engage in retelling the story to build comprehension. Words for the stories are selected to be sight words so children see the purpose of reading, which is to learn information. And the concepts about print are taught connected to the themes and exercise. For example, sight word is jump, because we do exercise, and that's an exercise word, and it's in the book we read. And the first letter of the sight word, in this case, is a J, so children are exposed to that, and its sound and symbol as well. Teachers model this, and children practice it. And this is building both phonemic awareness and phonics. And when the children connect the sound and the symbols of the letters, thus learning alphabetic principles. Children have the opportunity to write the letters focused upon, to develop fine motor skills, and further recognize the relationship between reading and writing. The teachers introduce children to concepts about books by naming the author and illustrator of the story, the title of the book, and identifying the print on the page and the pictures. And we also often don't think of this as a literacy skill, but it is, that children need to be taught. Children think about the theme using the sight words for reinforcement. So as an exercise thing, they will sing, if you're happy and you know it, jump up and down. This provides active involvement for the children to learn and to practice. Their families are an important part of the program. Parents and children, parents are the first teachers children have, and for the longest period of time. The next group of people they interact with are pediatricians before they go to school. And when pediatricians include literacy information for parents, this enhances the child's development and the equity for families that are vulnerable. We know that children who enter kindergarten with large vocabularies and some knowledge about books and print are most likely to succeed in reading. And providing parents with knowledge about how to help their child with literacy skills plays an important role. In the program, children and parents work together. The program has set routines, which Manny mentioned, at each session, and activities modeled. It also provides an activity book for practice skills at home. Parents learn best practice in reading to their children and discussing what has been read to increase vocabulary and knowledge. We have data to show that parents are using what they learned. For example, in the bedtime routine theme, reading to your child before they go to bed is emphasized. Based on pre and post surveys, parents were reading more at bedtime after the program began. During the routines, during the nutrition theme, parents learned about healthy food and were providing more fruit snacks for the children than prior to the program. And during the nutrition unit, we sang also, if you're happy and you know it, eat an apple. The organization of the sessions with fixed routines helped the learning to take place. Often children came to the session with a different adult who at first seemed uncomfortable, and the children assured them they would help them with the activities. In terms of feedback, it was important and necessary to get feedback from the partnerships involved and to maintain the synergy of the different groups. Getting backgrounds from teachers who taught the program helped us refine strategies. They also gave us information about children's behavior during the activities, and this happened throughout the pilot program. Well, parent feedback helped us to find out what they learned and what they found most useful. And again, this resulted in changes in the program. The framework from the pediatricians, educators, advisory board, and the linguists in this dual language program were all necessary and enhanced practices. And once again, I really thank you for welcoming me into this, because I really love the work.
Thanks, Lesley. Silvia, you're up.
Yep. So I just want to stress the word partnership, which has come up a lot in everything that we have presented. And this has been truly a very productive partnership, one that I've learned a lot from. So I came into the team as an expert on bilingual language acquisition. I work with a lot of heritage populations of Spanish in the US. So most of the things that I see are some of the effects of prolonged language contact between mostly Spanish and English, but also in other multilingual populations. So I had seen that initial vignette that Manny brought at the beginning of the presentation from a different perspective, as a linguist, as a mom of a bilingual. So I had been exposed to that problem many, many times. And for me, it was really interesting to bring a different part of the puzzle. That's how I also saw this collaboration, as having a common problem that we could try to solve from different perspectives. So one of the things that I was really interested in is trying to help the team and work with the team on empowering families to maintain their heritage language. And I think that from the different perspectives that we worked in, whether it was education or medicine, we all came to the same conclusion, but we were missing some parts of the puzzle. And how can we get parents there to that mindset of, let's use the heritage language, this is useful, but also move the children forward in a system that does not really provide a lot of support for the growth of the heritage language. So I think that that's where our partnership was the strongest. And I think that we brought like the meaning of team science to life really with the collaboration that we all put together here. So yeah, that's all I have. Like, we can stress more about, how our partnership worked and, how what type of expertise I brought to the team. But for me, it was a growth experience in the sense that I had not collaborated with such multidisciplinary teams in the past. I had been working on my own linguistic silo for a very long time. So for me to be exposed to new ways of doing research, different mindsets, and also different areas of expertise has really impacted the way that I do my research right now, even projects that are not collaborative in nature. So that's one of the things that I take home, that it's pretty invaluable. And I bet that a lot of my other collaborators in this team are also taking with them.
Thanks, Silvia. Usha?
Thanks, Manny. I am Usha Ramachandran, a general pediatrician, and I provide primary care for children. And as Manny mentioned earlier, I've been involved with the Reach Out Read program for over 20 years now. And most people who went into pediatrics went into it because they want to make a difference in children's lives. And we all recognize that, especially the first few years of life, can have such a long-lasting impact on the trajectory of an individual. And as much as we recognize the importance of all of the stuff that we do in well-child visits, like immunizations and so on, but we also realize that sort of getting them ready for school it can sort of give them that can sort of set them off and give them a great opportunity, a great foundation for future, skill acquisition, for better, both social outcomes, academic outcomes, life outcomes, and so on. And so that's what sort of got me into Reach Out and Read. And we've been trying to promote, a love of reading, shared reading, joyful, interactive shared reading with families for the last several years. But I am so thankful to this project because it allowed me and my colleagues here at Chandler Health Center to really get out of our silo of the primary care site and interact with families in a different way. And to sort of put our heads together with, people like, the people who are on this webinar, but also our colleagues from elsewhere, put our heads together with other experts in the field. We all had the same goal, and we kind of approached it with different lenses and different perspectives, and it was really, really a great experience for me. So what I brought to and I and the other pediatricians brought to the table was our, so we are required, or, the American Academy of Pediatrics recommends that we, and, has put out these guidelines called the Bright Futures Guidelines that talks about all the different things that we should be promoting during health maintenance, regular well-child visits. And so topics like nutrition, sleep, activity, social emotional skills, relationships, we talk about all of these things during well-child visits, but we only have in the best case scenario, 20 minutes to do it. It was so great to have that opportunity to work with this team to sort of expand those messages that we, share with families, and to be able to do it in a way that, with family input, to sort of understand what are the ways, what sort of messaging resonates with families. And how do we include these things in the context of a family's daily lives and so on? And how do we sort of tailor all kinds of skill acquisition and just sort of build it into these day-to-day things that families are already doing, and health-related activities that families are already doing. So that was a great experience for me. We got to also, myself and Dr. Pai, also got to actually attend these sessions and do like a question-answer session with the families during the sessions. And that was the nicest experience, because we were seeing our patients, some of our patients, they were not all our patients, but we were seeing some of them outside the context of a clinic visit. And the kids would recognize us and say, "Oh, that's my doctor." And then, the parents would ask us questions, and it was a really great way to get to know our families outside of the exam room. And as much as we've always talked about leveraging primary care and the relationships that pediatricians have with families to sort of build these literacy skills and sort of do that warm handoff with the education system, I felt like this project was a two-way street, in that it sort of helped us strengthen our relationships with these families. Just the fact that we were able to offer this to families was, families would tell me, "Oh my gosh, this is so great." And, the feedback we got was that families felt like we really cared about them outside of just, caring about the child's physical health. So it was a really great experience for me. And thank you to all of you who were a part of this project. And thanks, of course, to Manny for including me in this.
Thanks, Usha. So just quickly, and then I'll pull down the slides so we can have a question and answer. But a quick study progress report. So as I mentioned, we completed AIM-1 2 summers ago. We're now in the process of recruiting for our randomized clinical trial, assessing the effects of the program on children's literacy, language skills, and social emotional development, as well as parenting routines, both from an academic perspective and health perspective. And our process evaluation is ongoing. And so before pulling down the slides, just a couple more thank yous. So one to our incredible partners from the Greater Brunswick Charter School, who've been so important throughout the whole process. The teachers came from them, come from GBCS. They were kind of the early team members in terms of allowing this intervention to come together. And then, of course, the support of our sponsors. So the Agency for Healthcare Research and Quality, which is supporting this phase of the work, as well as past funders as well. The Rutgers Community Health Foundation and Global Health Institute. So I'll pull down my slides.
May I ask the first question? Dan and Nancy, thank you all so much. What an insightful presentation. And I'm curious on the team science side, and also as a father of 3 children, I was taking a lot of your guidance and keeping some notes here as I think about my own parenting practices. But one of the real themes that stood out to me is this idea of partnerships, the partnership that you all were able to cultivate as a team, and also the partnerships that you formed with your school colleagues and members of the community. And I'm wondering, did you encounter any challenges or impediments as it relates to the forming and the sustaining of some of those partnerships throughout the community during the time of your work together?
Thanks, Ralph. And it's such a great question. And now I'll kind of take a first pass, and then please everyone jump in. But I think this is a real important topic in community engaged research in terms of how you form meaningful partnerships and then engage partners in a substantive way. And so, I think like aside from like kind of the, sort of the tenets, right? Like trust building, relationship building, taking time to really, not to diminish those in any way, because they really are critical. And the time spent sitting at, Mr. David Harris, who passed away a couple of years ago, who ran the Greater New Brunswick Daycare Council, and just really learning from the community, learning from them, and the same thing with our partners at GBCS, really kind of hearing from their perspective what were the issues that they were seeing. And so I think that two-way communication, I think, is critical. I think, like one of the barriers is always time. I think there's always like this pressure in terms of productivity, which of course is important, but really ensuring that it doesn't come at the expense of trust building, and then really following through to ensure that, we just don't conduct research and then leave, that this really has a meaningful impact on the community, and something that we all learn from collectively, from from the community members, the parents, everybody involved.
Yeah, no, I was just gonna add, to facilitate it, so definitely communication, like you mentioned, right? So with the academic side, right? So our updates, our meetings with them, and also having smaller and larger meetings whenever necessary, so that everyone is updated on things that are in their expertise area, but then also bringing it all everyone together and explaining what's going on. So facilitating those discussions, and definitely on the community side, meeting with them, definitely updating as well, and also, like Manny had mentioned, acknowledging their contributions in say academic papers or presentations and etc.
Great, thank you so much.
This isn't really about teamwork. First of all, this is an incredible example of interdisciplinary research, community-based participatory research. I love how you had the clear roles for the parent advisory committee, it's very clear which pieces of it they're involved in, and by inference, which pieces they're not, like the actual data analysis and evaluation of the program and research design. And the same thing for the community advisory committee. So this is just a great example. So if I'm ever talking to somebody about community-based participatory research, this is like a perfect example. So I had two questions. I don't know if there's time, but it sounds so harmonious and great, and you all intersect and you bring in all your disciplines. But I know I've been involved in interdisciplinary projects. And are there ever communication problems between the investigators because you have a different lens, in all this? And it's great. You could benefit from everybody's expertise and viewpoints, but sometimes there could be conflicts or lack of communication. So that's one question. And the other question is, what's going to happen to the program once the grant is over?
Silvia, we were just actually talking about the first question earlier.
Yes.
Do you want to take that one, and I can and everybody else, and then certainly the second question I've been thinking about. Lesley, you've been thinking about a lot in terms of what we can do, and so maybe we can start there.
Sure. Yeah. Miscommunications happen all the time. And we just had a meeting this morning where, we come from very different disciplines, and we were talking about the word infant and how I understand infant in a very different way than Manny does or other members of the team, right? So I think that for us, what's key is to have an open mind and communicate with each other. What is the understanding what do you understand by this concept? Or how did you get to that conclusion? Or why do you suggest that we apply this certain procedure? And I think that having a leader, and I have to say this, Manny, having a leader who practices what he preaches and listens to everybody and tries to incorporate a little bit of expertise from the different stakeholders that are in the team is key. If we didn't have such a visionary working with us, it wouldn't have worked, because we all have the best of intentions, but at the end of the day, silos was another word that we mentioned before, right? Like, we're all in our silos. We're very comfortable working with the people who understand what we mean. But it's like, it's taking another step and trying to make other people understand what we mean, and at the same time reflecting about what our understanding of the word or the concept that we just used means in a broader for the general public, right? So it does happen, but I think the communication piece is key.
That's great. That's great. You can hold off on my second question. I mean, if Dan, do you have a question about teamwork or the processes?
Well, I'm happy for you to go ahead and address that, and then I can ask mine. Yeah.
I'll answer the
Usha, did you
second part of the question. Do you want to go there about what happens after the money's gone?
Briefly, yeah.
I truly believe that that this program will do well in a pediatric program, hospital, teaching hospital. I don't think your average pediatrician is going to do this. However, I see a place for it also within preschool as a theme, themes that can be used for early literacy instruction throughout the curriculum. And that's where the other thing is, if pediatricians were mandated, I know it's recommended by the Pediatric Association that you include literacy in your well-child visits. But from what I understand, there's nothing in the boards about that. And it's just kind of, if you got somebody who's interested, they put it in, and if not, I'd like to see that become a module in residency education, because it is crucial to the development of the children. And the physical and mental growth just go together so much. But I think it could definitely be used in as a summer program, just as we're doing that for school districts. I think it has tremendous potential.
Thanks, Lesley. And I'll just add also to that point. I mean, really the meticulous work that you've done, as well as Dr. Lucy Licata, who's a member of our team, in terms of putting together the manual and putting a lot of thought in terms of the way it was presented, as well as kind of paired with the activity kit in a way that actually, like, when we're done with this, we can actually make it available. And so that others can actually pick it up and implement it themselves. And so, recognizing that there'll be a lot more work to do on the back end, as opposed to, if you build it, they will come. But we're looking forward to that phase of the work, and working with our partners at Reach On Read and the American Academy of Pediatrics, which Usha has leadership roles at, to really think about how we're push this out once we have findings.
Great.
And Usha, I saw you had your hand up earlier. I don't know if you want to comment on this particular issue or the one before.
So I'll start with this. I think there's more and more recognition in the pediatric world about the importance of early childhood supports for families. And so there's, HRSA is kind of really coming up with multiple early childhood initiatives, aimed at, early childhood development and family supports and so on. So I can sort of see something like this, at least a modified form of this being, there's these programs such as Healthy Steps and different other programs like that where they're placing a trained early childhood specialist within pediatric primary care who can support the medical folks in promoting early childhood development. So I can sort of see a role for maybe that Healthy Steps person to facilitate some of this and so on. So definitely there is interest, there's more and more recognition, and the fact that kids are falling behind in reading, kids haven't caught up after the loss for the pandemic. I think there's going to be more and more interest in these kinds of interventions, especially interventions that take into account like family voices and respect family, families' cultures and experiences and so on. So I'm hoping that will lead to sources of sustained funding for programs such as this. But I did want to actually also go back to the question before this, which was, I think that question was how, it's hard when you're working with people from different disciplines, and how do you overcome it? So I just wanted to, for sure, it's, there certainly are, challenges that you come across. For example, like what to include. These sessions had to be small, right? Short, because that's the attention span of an average, kid entering kindergarten. And so what to include in each session was hard. Everybody had their own priorities, right? As an educator, Lesley had her priorities. And as a pediatrician, I was like, oh, well, shouldn't we be talking a little bit more about that? And so on, right? So clearly there was that. And as Silvia mentioned, I think it really having that respect for each other and having leadership, like Manny, who just was a very skilled communicator and took the time for us all to sort of meet and build those relationships and, build that trust and see where each of us was coming from, feel respected, and also have that transparency in the process, where we all sort of knew why the decisions were being made the way they were being made, and everyone felt heard and respected and as an equal partner in the process. I think was really, really key and really useful.
One thing I'd like to mention, I don't see this as just a program for at-risk communities. Very educated parents often don't know how to read to their children or don't read to their children. My daughter, who is a lawyer, she had her first child. She was like all thumbs, and she had me come to the pediatrician so I could hold him and she could listen to every precious word that they were going to say. And they didn't say anything about literacy. And I said to her, "You're reading to him, aren't you?" And she says, "Well, he just bites the book and hits the book." So I stopped reading. So it's not just for people who are vulnerable and so on. People don't know a lot about talking to infants and kinds of things they can do. So it's just not one group. I see it has a broad perspective.
Well, thank you. And I just want to thank you all, Daniel, Lesley, Silvia, Usha, and Manny, for sharing all of your experiences and your expertise and your insights into a really impressive and collaborative team science project. We wish you certainly all the best of luck and great success. Not that you need luck, as you continue this important work. So, and I just want to thank all of our viewers for joining us today. To remind you that there are other episodes from this series on the NJ ACTS Team Science Core website, as well as opportunities to request a consultation, and also just putting in a plug for the next seminar in our series will feature the team from the New Jersey ACTS based project, the NIH ECHO project, Environmental Influences on Child Health Outcomes. So another child health oriented project that you might recognize. Some of the same investigators are part of that as part of this you heard today. And thank you so much.
Thank you.
Thank you.
Thank you.
Thanks, everyone.